Hey guys, Tierra here with Doc Girl Fitness, and today's video is all about my 12-week post-op recovery update for the hip surgery I received at age 26. For those of you who don't know, I'm Dr. Tierra Range, an intern resident physician in pediatrics who makes videos about medicine, lifestyle, and fitness. This video you're watching right now is one of a set of specific videos I'm making regarding my journey to recovery from a hip surgery I received at age 26. A lot has happened since the last time I updated you all, so let's catch you up to speed. At 6 weeks post-op, I had an in-person visit with the pediatric orthopedic surgeon who performed my surgery. At that time, he said that my recovery was going well enough to transition me from a walker to a single standing crutch, meaning that rather than having to rely on both of my hands on a walker to hop on one leg to get around, starting at that point, I have been able to use a crutch on the good side, or the side that has not been operated on. And I basically use that crutch to walk in alignment with the side of my body that had the surgery, and they walk together in sync. And then I use the leg that didn't have the surgery afterwards, and I kind of walk in tow like that. He made me practice a lot in the office with his in-person physical therapist before I left for the day, and one of my parents filmed the process, so I'll include a clip of that here. As you can see, I was still a little bit shaky, but I was still so happy to finally start bearing weight on my hip. In addition to clearing me for weight bearing, he also cleared me to begin physical therapy. This basically involved him giving me a prescription for a physical therapy appointment, and I presented this information to a physical therapist of my choosing that was within the network. And I personally met with this physical therapist, and she evaluated me, and after her evaluation, she decided how many times per week she thought was best for us to meet based off of my recovery and my goals. And then she also decided a timeline for how long she thought we would be meeting over the period of my recovery. For me personally, that meant meeting 2 times a week, which was based off of how I was already performing at the time we had our initial evaluation. And also it was based off of how taxing she knew my job already was, and how hard it would be for me to get off work early enough for physical therapy multiple days a week, since I am working anywhere between 70 and 80 hours a week as a resident physician. She and the pediatric orthopedic surgeon who performed my surgery also decided that it would probably be best for me to remain in physical therapy for a minimum of 3 months, just working on achieving maximum mobility for my everyday activities of daily living, or ADLs, as well as for whatever activities I needed to accomplish things like work. Anything beyond that 3 months, they still think I will need their help, but it will be in a different capacity. And that capacity will be working on strengthening myself enough for a life outside of work and just being able to do things around my home, because that's an important part of daily life as well, right? But all of this is just a projected timeline. They are not entirely sure of how long it will ultimately take me to recover to even the point of returning to all of my activities of daily living and a full level of mobility at work. Right now it's tentatively 3 months, but it could be longer. But that's something that we're gonna find out along the way. At the beginning of physical therapy, a lot of the exercises the physical therapist had me doing were lots of stretching in different positions, and only using my body weight to perform those stretches. Also, for the first few weeks, I was using my crutch at all times, both inside physical therapy appointments and also at work. By about the 3rd week of physical therapy, I was cleared to start practicing my walking without using the crutch while at home, and only using the crutch while at work. Then a week later, I started practicing bringing my crutch to work, but for short periods of time, like while I'm in the workroom, not using my crutch to get around. And now I'm at the point in my journey where I bring my crutch to work, but for half of the day, I don't use it, and I just get around walking with my own body weight. By the latter half of the day, I'm allowed to take out the crutch and use it if it's necessary. Now I keep mentioning work, but what does work look like for me? The last time I talked to you all, I was still in the first 6 weeks of my recovery, and I was using most of that time to work from home via telemedicine. After the winter holiday break, I started back working on the wards as a resident physician, seeing patients every day, and working in the hospital setting 6 days out of a 7-day week. Lots of walking was involved, and it was definitely a shock to the system to go from being completely immobile to walking around all day for 12 to upwards of 14 hours a day. Although it has been an adjustment for me, it's something that I feel has also very much so propelled the speed of my recovery, because I'm constantly moving and I very rarely have opportunities to get stiff, or basically to have my muscles get stuck in a position where I'm not moving a lot in a day. As a resident physician that's currently working in the hospital on the wards, I'm working about 70 to 80 hours at a maximum in any given week. My physical therapist has really worked with me and has allowed me to meet with her twice a week, every week. And so on the days where I only work about a 10 to 11 hour work day, I leave work and then I go to physical therapy. As I mentioned, when I first started physical therapy, I was doing lots of light stretching, and a lot of that stretching was done with my own body weight. That then moved forward to using resistance bands and to cranking up the physical therapy sessions by including some balance exercises. Now I'm at the point to where I'm still doing some of those stretches, but all of my stretches are done with some sort of resistance band. I'm also pedaling on an exercise bike for at least 5 minutes of every session. I'm doing weighted squats with a 16 or an 18 pound kettlebell, and I'm also doing leg presses, and right now I'm leg pressing about 60 pounds. So as you can see, I started out really slow, but over time and with a lot of work, I've really been able to excel in physical therapy. And that comes not only from the in-person sessions, but also my physical therapist gives me homework on exercises that she expects me to be doing at home when I'm not in physical therapy, and I make it a point to do those without excuse. I noticed that at the beginning of this work rotation, it was really hard for me to go to work all day and then feel comfortable coming home and not just passing out. So I started bringing copies of the exercises with me to work, and I would do the exercises at work when our schedule during the day was a little bit less busy. My co-residents all understood what I was doing, and nobody picked on me, and everybody was actually really helpful, and some of them would actually time me whenever I was holding different moves, or they would help me count my reps for different exercises that I was performing. It's all been a very large adjustment, but it's one that I feel like I've been able to do by praying a lot, keeping strong in my faith, continually tapping into my support system, and just staying as positive as I possibly can. The next big hurdle in this journey will be meeting up next week with the pediatric orthopedic surgeon who performed my operation. Once again, it will be the first time that he's seen me since he transitioned me from the walker to weight bearing with a crutch. At our last appointment, he told me that at our next appointment, I could either walk in with that crutch or I could walk in without anything, and that it would be entirely up to me. So of course my goal is to walk in there without any assistance, and fingers crossed, if I continue to excel, I'll be able to do so without issue. As I said, I'm only weight bearing for half the day, and this appointment with him will actually be at the end of a long day of work, but I'm still really hopeful I'll be able to hang in there. And put my best foot forward, quite literally, at my next appointment. Regardless, I'll make sure to keep you updated. And speaking of that, I've been reading every single comment that you all have been leaving on my YouTube videos and also in my DMs on Instagram. And let me just say thank you so much for reaching out to me. Every single comment and every kind word has made every single part of recording my recovery so much more worth it, knowing that I'm reaching out to people who are also going through the same thing. And I can't wait to answer more of your questions through some of these videos in the coming weeks. The next video that I plan to upload, I will also dedicate to my hip journey, and that video will be in direct response to what I've gotten the most questions about, both on my YouTube channel and also on Instagram, and that is about what to bring with you for an extended stay in the hospital whenever you go for your surgery. It's an excellent question, and one that I'm so happy and so excited to answer for you all. But for those of you with other questions, don't worry, I can't wait to get to those too. In the meantime, if you liked this video, make sure to give it a big thumbs up. If you have any questions or you just want to chat, always feel free to let me know in the comment section below. And if you like videos like these or any other videos about medicine, lifestyle, and fitness, make sure to subscribe to my channel. Once again, thank you so much for reaching out to me, and just know that we're all going through this journey together, and I'm so excited to be going through this journey with you all. I'll see you next time.